everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is on models in patient care. Now, in this video, I'll be talking about three main parts. The first part is about the common models in patient care. The second part are the components in patient care, and for the last part, I'll be talking about the Roper, Logan, and Tierney model. This is a model which is common in the UK. So I'll be talking about that in the examples part, which is the last part. Now let's get started on my first part, which is the common models in patient care. Now here on the mind map, I have researched four main models in healthcare. So these are the four main common models in healthcare that I have researched. The first one is person-centered care. Now, person-centered care is basically holistic care. Now, you might be asking, what is holistic care? Well, holistic care is the care for one person that not only focuses on the physical aspects, not only focuses on the sickness and the symptoms of the illness, but it also focuses on the social and emotional aspects of that person as well. So that is what holistic care is. Now, for this person-centered care, for this type of model specifically, it requires and it includes the person, the patient, the person's family, and also the care. So those are the three main individuals and three main subjects that are included in the person-centered care. Now, this type of care promotes independence. It allows patients to be able to make their own decisions. For example, when to wake up, when to bathe, when to take their food, etc. So this promotes independence and allow patients to make their own decisions on their care and their daily routines. So that is the first part, which is the person-centered care. The second model that I have researched about is functional nursing care model. Now, this functional nursing care model requires a whole team of nurses. So this whole team of nurses will include a head nurse and other nurses as well. So the head nurse will delegate the tasks. The head nurse will be experienced an RN or an experienced nurse that will delegate the task within the team and equally. So this helps during the staff shortages and emergencies. So this basically what this model is that it requires the most work. It will have the most work out of the least people. So using that staff shortages, this is probably used in staff shortages and emergencies where there is a limited amount of staff, but there needs to be a lot of work done. So this is the functional nursing. Now, this type of nursing care model is not usually used and not recommended in healthcare because it is not holistic care. It is not efficient. It is efficient, but it does not hold the trust and builds the relationship between the team, which is the type of the nurses and also the patients. So it does not build that relationship and it does not build that type of rapport and trust. And this is the hierarchy. This includes hierarchy, which means that the skilled nurses will have more complex tasks, and the basic tasks are for other nurses who are not as skilled as the others. So this is efficiency driven, but it is not recommended, I think. So that is for functional nursing. The next one is primary nursing. Now, primary nursing is one-on-one, what I mean is that one nurse will be in charge of one patient. So that nurse, for example, I will be in charge of one patient, and from admission to discharge, I'll be in charge of that patient, from care, from planning, from delivering and evaluating care. So I'll be in charge of that whole patient in their period of time in the hospital, so their hospital stay. Now, an advantage of this is that it will build rapport and it will build trust, and also there will be a good relationship between the doctor or the nurse and also the patient. That is the primary nursing. It is the patient is in charge. The patient is in the hands of the nurse. So the nurse is in charge of the holistic care of that patient. That is for the primary nursing. As for the team nursing, or also called modular nursing, is one group of nurses will be in charge of one group of patients, typically falling between 5 or 6 patients at a time, and that team of nurses will be in charge of that group of patients. And this is dividing responsibility among the teams. This will be a diverse team, so there will be RNs, there will be LPNs, there will be assistant nurses, and also technicians. So there are diverse members. The team leader is most commonly an experienced RN or a registered nurse. So that is for the team nursing, and that is for the 4 main common models in patient care. Let's review. The person-centered care is family patient and carers. The functional nursing is the whole team of nurses caring for a patient. And for example, one nurse will check the vital signs, one nurse will check their symptoms and things like that. One nurse will give medications, one nurse will help care for them, give medications, things like that. That is for functional nursing. Primary nursing is one-on-one, which means that one nurse will be in charge of one patient. And lastly, for the team nursing, one team of nurses will be in charge of one group of patients. That is for the common models in patient care. Moving on to the next part, which is the components of a model. Now, there are 4 main components of a model, which is service organization, care processes, management, and theoretical basis. Firstly, I will have service organization. The first component of a model, a patient care model, is service organization. So this will be defining the roles, defining the service packages, referral pathways, etc. That is for the organization of the whole model. There will be the core processes as well. For example, protocols for care delivery, patient transfers, etc. So those are the processes of that model. The third component of a model in patient care is management. So this will include leadership, team members, team structure, supervision, financial management, etc. So this is management, which means that it is the management part of that patient care. So leaderships and financial management, things like that, etc. And fourthly, the final one, is theoretical basis. So philosophies such as holistic care, evidence-based care, or value-based care. Now remember, in the first part I talked about the common models in patient care. There are lots and lots of other models in patient care that I haven't have the chance to talk about all of that in this video because they're just too much. And I've just talked about the 4 main common models in patient care. So there are other models that are based on holistic care, which I talked about in this video as well, evidence-based model care, and also value-based care. So those are some of the theoretical bases, some of the philosophies that the model in patient care is based on. So those are the components of the models in patient care. Lastly, for the example, so the Roper, Logan, and Tierney model of nursing. The Roper, Logan, and Tierney model of nursing is a common model used in the UK, which is set up by 3 UK nurses. So it is named after 3 UK nurses, which is Logan, Roper, and Tierney. And it is based on the 12 activities of living, or sometimes called AOL. Now, what are those 12 activities of living? Well, the first one is breathing. There's also maintaining a safe environment, communicating, eating and drinking, eliminating, washing and dressing, controlling body temperature, mobilizing, working and playing, expressing sexuality, sleeping, and dying. So those are the 12 main activities of living. Now, in this model, a nurse will assess the patient's 12 activities of living, or AOLs, that is the AOLs, to understand the patient's health status. Now, using AOL, using the 12 AOLs, they will be able to evaluate the patient's level of self-care ability. It helps them to evaluate the patient's self-care ability. For example, their self-care ability with their family as well, and it moves them to be more independent. It allows them to be more independent in decision making. So that is for how it helps with the patient. Now, this is a hierarchy of needs. So this is a hierarchy of needs. This model is a hierarchy of needs. As you can see on this illustration here, I have the 12 main ALLs, or activities of living. And as you can see, dying is at the top, breathing, sleeping, mobilizing, communicating, eating and drinking, etc. Now, what do I mean by hierarchy? Well, the hierarchy of needs means that the first one and the most basic one, the most important one and crucial one is basic physiological needs. The second one is safety and security, and the third one is love and belonging. So love and belonging will sometimes be secluded from the most nursing care and interventions. So most nursing care and interventions will focus on the first two ones, which are basic physiological needs and safety and security. So those are some of the aspects and some of the characteristics of the Roper, Logan, and Tierney nursing model. Now, I will be talking about this in my second DE as well. I will be elaborating more on how does it work, how it is used, and etc. So that is for the third part, which is the Roper, Logan, and Tierney model of nursing. Now, how is it used? Well, there are four main parts. There's assessment, care planning, intervention, and evaluation. And I'll talk about that in my second D as well, but that's how basically it is used. And that wraps up the end of my main video in the models in patient care. I hope that through this video you learned something new, or you just review some of the things that you have learned. If you have any other questions, or if you have any opinions, suggestions for improvement on my video, then please share it with me. I'll be glad to hear them all. Thank you again for listening to my video, and hope to see you soon. Goodbye!